So my name is Stefan Leeffers. I'm a lecturer in the Department for Risk and Disaster Reduction, and today I'll be talking in this um, taster session about what works in humanitarian action and what is worth funding. So this is a quick insight into the topic of evaluation in humanitarian action, thinking through how to create evidence that can help us answer these questions around what works and how should we be spending the very valuable humanitarian action money funding. Um, so let me see if I can move to the next slide. There we go. So a little bit more about me. So I teach in the Global Humanitarian Studies program, the undergraduate program in the department, specifically humanitarian and aid economics, as well as evaluating humanitarian action. I'm a development economist and study how different types of interventions in the context of humanitarian aid, humanitarian action, specifically can help vulnerable communities to prepare and cope with and even recover from disasters. Now, most of my field work that I do is based in Mozambique, but I also have some experience working in Rwanda, Angola, and the Dominican Republic. And besides my work in the department, I also am a consultant for the World Bank and the Center of Disaster Protection, where I advise on disaster risk finance strategies around the world, but also specifically in the Caribbean region, Central America. So in today's session, we're going to be talking about very briefly on what humanitarian action is. Probably in other taster lectures, you might have been already introduced to this topic, but specifically I'll highlight here why evidence matters. We'll talk a little bit about cash transfers, an important element of humanitarian aid. And this is followed by how to evaluate impact and a methodology that we can use for that. To then finish off with a discussion on how to evaluate an anticipatory action program, which is a relatively new element within the humanitarian action tool set, which we will discuss a impact evaluation study of. So very briefly then, what is humanitarian action? So humanitarian action is our actions taken with the objective to save lives and livelihoods, and very importantly, alleviate suffering and maintaining human dignity during and after human-induced and natural disasters. And then a very important last part to this definition is as well as to prevent and prepare them for these inevitable disasters. Okay, so there's the part of like the immediate action afterwards, helping those that need it immediately after disaster, but there's this important component where we think about how to prevent and prepare. And a lot of my research and a lot of the work that I do is in that in that last part. Now, humanitarian action includes both assistance and protection. Assistance seems like more straightforward. Protection here, think about gender-based violence or protection of children's rights, important elements as well of humanitarian action. Now, what I want you to think, just to contextualize this a little bit more, is more specifically think about farmers in low and middle income countries that are particularly vulnerable to climate shocks. Think about droughts, think about extreme weather events. Cyclones, for example, are a very common phenomenon in Mozambique. Think about flooding. All of these have a significant impact on the ability of farmers to provide for their families, for their livelihoods. Okay, so they're very vulnerable in this context. Now, for them, what does humanitarian assistance include? Imagine that there is such a disaster happening. Well, these humanitarian assistance includes mostly basic need support, initial food assistance, cash transfers. We'll talk about in a little bit in more detail. Shelter, water, and hygiene. but very important as well, health and nutrition, like medical care, vaccination programs, etc. Then the protection and safety that I briefly mentioned in the previous slide, so child protection, gender-based violence support. A more increasing aspect as well is mental health, a very important support and counseling in that aspect. More recently, during the COVID-19 pandemic, we saw a strong focus on education in emergencies that has gained a lot of attention. So temporary schools, learning materials, and safe access. And finally, livelihood support. So rebuilding after disasters happen by providing tools, seeds, training, and small grants to rebuild or start new businesses. Now, what else can be done? And this is that more like that second component, what I was emphasizing in the definition of humanitarian action, like the medium and long-term adaptation. So this is more in the context of being prepared for or if something were to happen by, for example, nudging household to plan for contingencies and adjust their livelihoods, provide forecast information in the context of farmers, for example, providing information about the weather forecast for the season is a very useful thing to do and can help in adjusting and preparing the season. Provide better seeds, infrastructure such as irrigation and effective land management are important components that can help adaptation. And finally, providing financial tools such as insurance systems and guaranteed credit that can make farmers, but also other types of livelihoods, more resilient. Now, all of that, all of those aspects, all these tools within the humanitarian aid tool set cost a lot of money. So I put here a couple of figures on the slide to get a sense of the enormous scope of needs and response. And this is specific to 2024, last year. Now, people in need are estimated to be about 323 million people last year alone, of which in humanitarian response plans, almost 200 million were targeted, and eventually only 115 million were reached. So as you can see, there are a lot more people in need that we're able to target and even be able to reach eventually. And this has a lot to do with the funding available. So the required funding is estimated or was estimated for 2024 to be around 50 billion US dollars, but only about half of that was actually materialized. Now, when we look at the trend of these needs in terms of financing, but also what eventually has been able to be materialized, we see an increasing trend in the needs from 2016 till 2023. You see this increasing line of the combined, like what we're able to get and what are we able not to get. So the needs are increasing, and at the same time, you see that the funding available is actually not increasing as quickly. So this gap between what is being funded and what is necessary, this unmet requirements, this gap is increasing over time, actually throughout this entire period. As you can see in 2024 and 2005, there's a slight decrease in what seems to be the needs, but this has mostly to do with the fact that agencies are already reducing their targets and already like having a more focused approach to who they think they can reach, and redefining the definition of those in need. Now, in 2005, many of you probably will know about the aid cuts, especially in the United States, that have been happening, which has led to even less funding available. Now, in this context, it is extremely important that we know how to spend the money that is available well and in the most effective way possible. For that, we need evidence. For that, we need to know how effective the programs that exist, the tools that exist are. Okay. And besides that, to convince governments to continue to investing in humanitarian aid and providing this funding that is very necessary, it's also important to provide evidence of this actually working and this having an impact. So for that reason, we do evaluations. Now, before we head into how exactly we do these types of evaluations and create this evidence, let's have a quick introduction to cash transfers. This one very important component of humanitarian aid, and I want to do that by a short video. So you might know this person. This is a famous YouTuber, and he has asked himself the question, excuse me, what happens if you give every family in a village a full year's salary? So this idea of providing cash transfers. So through this video, we're gonna look at a small part of the video. I encourage you to look at it, watch it later again. I'm going to introduce this topic of cash transfers.
This is $1,000 in cash. And if you suddenly came across this kind of money, no strings attached, what would you spend it?
They're put on display so that we can choose the clothing we need and want.
Well, for hundreds of thousands of people in rural Uganda, this money would be used differently. Most of these people live off of as little as $1 or $2 a day, meaning getting an education, starting a business, receiving adequate health care, or even electricity is nearly impossible. So I guess the solution is simple, right? Why don't we just give them the money? But on second thought, giving thousands of dollars to people who have never experienced that kind of money before is extremely irresponsible. So when an organization reached out to us to help them do just that, we knew we had to fly over and find out more.
Uganda is a beautiful country and is filled with some incredible people. But when I first got approached by Give Directly about this program, my initial reaction was this was a terrible idea. I thought that giving an entire year's worth of income to people that were living in extreme poverty sounded like it was a recipe for disaster.
Give Directly uses a strict selection process to identify villages most in need and signs up every single family. They then provide the recipients with a mobile phone and they create a unique PIN number. The money is then sent to their SIM card so they can transact directly or go to a nearby outlet and use their PIN to withdraw cash from a mobile money agent. The limited work opportunities in the community has made it extremely difficult for the villagers to support their families. One of these people is Paul.
I have a wife, 2 kids. This is why I'm staying. My family is eating a day once. That's we eat once, supper time. Those are the challenges we are facing.
If Paul had more money, he would not only invest in starting a business in the area, but also ensure that he and his kids can get a proper education.
My aim is to get that certificate of Singapore. Maybe that life, my life somehow improving from that part.
People living in extreme poverty are very limited. Most of their day is taken up by menial tasks, and they cannot break themselves out of the cycle of poverty that they're stuck into.
A year ago, this was the reality for Tian and Lokura. The kids had dropped out of school, and finding work in the area was extremely difficult for them. But after receiving a donation from Give Directly, their lives changed entirely. They used the money to buy land in the area and have now started cultivating their own crops. They also bought a grain mill and are now processing grain for the entire community and earning a small profit.
They are now using those profits to open up a store in their house.
And on top of that, Lokore has now started a refueling station in the village.
This is a great example of what this program does because it fuels an economy that allows them to build businesses.
But still somewhat skeptical about the idea of direct cash, we want to better understand the benefits this would have over more traditional forms of assistance.
Okay, I'm gonna stop it there. And want to pick up on that last question that Mr. Beast asked. So how do we know, like, how do we actually know about whether giving cash works better than other more traditional forms of
This is
of aid. Okay. And the way that we find this out is by evaluating the impact and comparing these different types of programs. So when I ask you, what is the most effective way to improve food security, whether it's cash, whether it's through vouchers, or whether that is to food, think about it for a minute for yourself. What you think would be the most effective way here? What is the most effective way to improve food security for a low-income household, possibly recently impacted by a disaster? So when I ask this question in a classroom, I get a very wide range of responses. Usually it's about like 30% is going for cash, maybe 40 for vouchers, and another 30 for food. It's often very evenly distributed because it's a difficult question to answer, and it will depend on a lot of different factors, of course, but it's one that we can actually study. Now, before digging into more the methodology here, it's really important to have this definition of food security clear for us. So what does food security mean? And how do we measure that? Now, food security is, of course, about the frequency and the quality of the food that a household consumes. And the way that we often try to measure this is by surveys, doing surveys with households, the head of the household, or other decision maker in the household, asking questions like, for example, in the past 4 weeks, did you worry that your household would not have enough food? Now, this is a type of question that gives a very subjective, a perception of this respondent's ideas of their experience of food insecurity. Now, on the other hand, you can try to get to a more concrete, a more specific outcome of food consumption, for example, through a standardized food consumption score, which evaluates the frequency and the nutritional quality of food consumption, where the same question is asked for a lot of different food groups. And this question specifically is, how many days over the last 7 days did most members of your household, more than 50%, eat the following food items inside or outside of the home? And then it's listing, for example, meat. It will list dairy products, cereals, and many other food and nutritious food groups. Okay, so that's how we usually would be measuring food security for communities, for households. Okay, now before we're going to go back to the bigger question of like what's more effective, cash, vouchers, or food, let's focus first on cash to explain you this idea of like how can we create this evidence, how can we develop this methodology to actually answer the question, what is the impact of cash transfers on food security? Now imagine that we have collected this data, these surveys with a community, with households, different communities with different households over a certain period of time. Okay, so here on the y-axis you can see the food security. The higher this food security is, the better for the household. Their score is higher. And then on the x-axis, you can see the time passing. So over time, this food security is going up and down and up, and there's a little up here. And then at some point in time, where the red bar is, we start a cash transfer program with all of these households. So we're giving cash, for example, like there was done in the video, and then we continue collecting data about the food security of these households. Now, if you look at this trend here, you see that food security is decreasing. But that doesn't necessarily mean that cash transfers are not effective. There might be a lot of different things that are at play here. So a simple before and after comparison of this data that we have collected would be invalid. For example, what might have happened is that there was the start of the pandemic here a couple months right before we started this cash transfer program. This could explain the downward trend in food security, while we at the same time also have the cash transfer program. This could mean that, for example, the cash transfer, like without the cash transfer program, the food security would have even been worse, but we don't know. Okay, so we need to collect more data. Now, one thing that you might want to do is collect data, this food security data, in a neighboring district that was not part of the program. That's the purple line here, the lower line, as you can see. Now, over time, it's moving in a very similar way. The food security generally is lower in this different district. Now, based on this data, could we say that the cash transfer was effective or not? It's still a very difficult question because you don't actually know what the weather was like in this different district. Maybe the weather was very good in the district that we are focusing on with this cash transfer program. There was good rain and the crops were growing very well, and there was a lot of yield from the harvest. While in the neighboring district, there was a drought, which is possible, for example, in contexts like Rwanda, where from one hill to the other, the weather can be completely different. Okay, so again, this type of comparison would um, give a lot of difficulties in us interpreting the data correctly. Now, an alternative way in which you could think about going about this is to just focus on those within the same communities that received the cash and that did not receive the cash. For example, what happens often in these cash transfer programs is that there is a cutoff for people above a certain income will not receive the cash transfers, while the poorest people in a community, the poorest families, will be part of the cash transfer program. Now, as you can see here, the blue line would then be the households that didn't receive the cash, and the orange line, the people that did receive the cash. Again, over time, this is developing quite similarly. And then there are some different changes, like different slopes here after the cash transfer program starts. But then again, there's this issue here that the people that are part of the program are very different from each other, right? Those are from the ones that are not part of the program. So to begin with, they are already very different. And the way that they react to getting cash would be very different as well. So again, this would not be the best way in making this comparison. What we really want to know is what would have happened to the people that received the cash, the beneficiaries, if they had not received the cash, right? So we want to know a family, what happened to a family that was receiving cash during this cash transfer program, what would have happened to them if they were not part of this cash transfer program, and make that comparison. But that is, of course, impossible because you can't be part of the program at the same time as not being part of the program. Either way, this is what we are aiming for here. And if we would be able to do this, we could find that for the same person, there's now this green line that is moving very similarly, but continues to be higher than actually what we observe in the people that are receiving the cash transfer, and there's no improvement. Or alternatively, if we then would see that these families are worse off and they have a lower food security, we would have a counterfactual that's B. And so counterfactual here is the group that, or the families that did not receive the cash transfer program, but are the same as the people that do receive the cash transfer program. So this the impossible situation, we would conclude that there is an improvement. Okay. Now, this very hypothetical, impossible scenario, there is a way for us to overcome this. Okay. And the way that we do that is by constructing an experiment. Okay, we are trying to construct this counterfactual, this control group. We're trying to find a group of people, a group of communities that is extremely similar to those that are in the treatment group. They're part of the program. Okay, so we do not see what would have happened. We need a treatment group and control group that are as similar as possible. So how do we do this? Now we do this by randomizing. Okay, and I have here a quick slide on that. So now imagine that we have all of these different eligible villages. There are green villages, there are blue villages, there are orange villages, there are purple villages. There are a lot of different villages with a lot of different people. Okay. Now it's key here that we are able to compare different groups of villages with each other. Villages that are receiving the cash transfer program and villages that are not receiving it, which we are going to call the control group. And the way of doing that is by randomly allocating this program to the villages. So half of the villages that were initially eligible, they're going to receive the cash transfer program, and the other half is not. So as you can see here then on the right hand side is that the cash transfer program group of villages are very similar in terms of the number of green, blue, orange and purple houses as in the control group. And that is pure by randomization. For this to work though, it's very important that we have a large enough sample, and like all of the details about how we determine the sample size and how we determine eligibility, etc. This we'll discuss in more detail during the lectures of the course. But this is the general idea. And then what we can do is make that comparison that we were trying to do in the previous slides between different groups. So we can do an initial analysis of the food security of all of the households, followed by the randomization and the implementation of the program in half of the households in villages. And then in the end, we're going to collect again food security data across both the treatment and control group. And then the only difference between those two groups, in theory, would be the treatment. And that can then help us determine the causal effect of a cash transfer program. Now, randomizing, especially in a humanitarian aid setting, in humanitarian action, can be quite difficult, right? It's unethical to withhold resources from those that actually really need it. But there are scenarios in which randomization, in which creating this type of evidence could be possible. For example, when the eligible population is much greater than the number of program spaces available, whatever the program may be. That may be a cash transfer program, but you can also think about an information campaign, etc. Now, in this case, the demand exceeds the supply, and for that reason, we could have a comparison group that can be maintained as long as the constraints exist, the financial and resource constraints exist. In this case, there wouldn't be an ethical dilemma because a subset of the population would always be left out. And then actually randomization might be the fairest way of attributing these available places in the program. Another scenario in which randomization may be an option is when the program needs to be gradually phased in until it covers the entire eligible population. So there could be a scenario in which, well, we can't be everywhere at the same time. We can provide support or cash transfers or training program everywhere at the same time. We need to do that at different phases, at different points in time. So for example, 1 year we can do a half, and then next year we can do the other half. Now then we can randomize the order in which the participants are receiving the program. This would allow us to measure the effect of the differential exposure to the treatment. So those that are initially treated, we can measure the impact and compare that with those that are not initially treated before they are receiving the treatment. However, in this scenario, it's not possible to measure any long-term effect of any program that we would be evaluating. And finally, something that we can do is comparing different modalities of a similar program. Think about the cash transfers versus food vouchers versus food baskets. If we want to make that comparison, it's absolutely valid and ethically okay to make a randomize over the different modalities of the program. Okay, so this is a randomization over how participants are receiving the program, which allows us to measure the differential effect of each type. Now, the drawback here, of course, is that it wouldn't be possible to measure the isolated impacts. We wouldn't be able to isolate just the impact of a cash transfer program because there is no control group. There's no group in which nobody received anything. But we are able to say something about the cost effectiveness or the effectiveness, relative effectiveness of the different modalities. So let's think about that a little bit more then. So cash versus vouchers versus food. There's this really interesting study done back in 2011 in Ecuador, where the Ecuadorian government requested the World Food Program to expand its assistance in the country. So the setting here is urban and peri-urban localities in Ecuador with a large number of Colombian refugees and relatively high poverty levels. Now, the objective of this program, of the World Food Program, was to improve food consumption, that what we just discussed, increase the role of women, and reduce tensions between refugees and host communities. Now, in their program, they were considering whether to do cash transfers, food vouchers, and food transfers to both Colombian refugees and poor Ecuadorian households over a period of 6 months. So they decided to do an evaluation and randomize over these 3 different modalities. Now, by doing that, so collecting this data of food security over time, before and after the interventions had happened across the entire population that they were studying, what they find is that the quantity of food consumed and the quality of food consumed for all 3 types of modalities were very even. Okay, so cash were like in cash, vouchers, and food, all 3 increased quantity and quality of food quite evenly. The number of calories actually consumed increased most for the program that was just food. Okay, it was positive for both cash and for vouchers, but when just food was provided, they measured that the actual calories consumed increased the most. And then in terms of diversity of the diet, that improved the most under the voucher program. Okay, the modality in which only vouchers for food were given. So here you can see how different modalities might have very different impacts depending on what you're measuring exactly. So vouchers and food seem to be a little bit more effective in diversity and calorie increase respectively. But that's not everything. Okay, there is more to the story here. It's extremely it's very expensive to run a food distribution program. You need to acquire all the foods, you need to do procurement for that, you need to think about the logistics, the trucks that need to drive around. Well, just transferring cash is extremely cheap nowadays. That is done very often through mobile money, where somebody is on their cell phone is receiving a message saying you have this cash in your mobile money account and now you can go withdraw it or use it via your phone to spend it on something. A lot more cost-effective way does. And that would allow for spending more money actually on the actual item that you want to give, for example, cash. So in this study, they are looking very specifically at the cost effectiveness of the modalities as well. And they find that both cash and vouchers are significantly more cost effective than providing food. And finally, they also look at the satisfaction of the beneficiaries, so those that are receiving the money. And here they find a very, very big effect on cash. So the satisfaction with the program is significantly higher when providing cash relative to vouchers and food packages. Okay, and all of these elements can be taken into account then to design the next phase of this program. This is how we create evidence, and this is how we then look at the evidence and use that for future implementation of new programs and decision making. So finally, what I want to discuss, and I'll use the last 5 minutes for that, is another type of humanitarian aid, which is called anticipatory action, and how we can evaluate that and look at a specific case study of how that was done in Nepal. Now, anticipatory action, for those of you that don't know exactly what that means, basically here we're trying to anticipate the inevitable disaster that is going to happen within a week, 2 weeks, a couple days even. And this usually happens by having a readiness trigger a couple days earlier, 7 days earlier, for example, in this case, where the rising levels of water uphill somewhere are measured so that we can predict the chance, predict whether there's going to be floods in several days in the lower lands. Okay, but you can also think about here anticipating a drought. For example, when for a significant number of days there has been no rainfall, and then it's very likely that this is going to cause some type of disaster event, and this can be anticipated. Okay, so instead of waiting for people to be in hunger and not be able to provide for their households, we can anticipate that and, for example, provide cash transfers or food packages or something already earlier in the onset of the disaster. Okay, now back to the example that's here on the slide. So once the readiness trigger is hit, it's at a certain level of water upstream. There are readiness activities. People are informed about the fact that there might be a disaster coming very soon. Then 3 days before, there is an action trigger where the rising levels have now reached the houses. It has not submerged them yet. But this is another moment in which there's a trigger and humanitarian aid is starting. So food transfers are made, the whole logistics is mobilized, and then the flooding actually happens. Okay, so usually under the more traditional way, we wait until the flood is happening, and then humanitarian assistance is activated. Here we anticipate the flood, and the humanitarian assistance happens before. But an important question here is then, does that really make a big difference? And will it outweigh the additional cost of actually giving cash transfers or other aid to people that do not necessarily need it, because it might turn out that their houses won't get flooded? Okay, so the advantage of the more traditional way is we know exactly who is impacted. Well, when we anticipate a flood, we do not know yet who exactly is going to be impacted. We only have an idea about the prediction, right? So we want to understand whether there is this significantly better, this a significant improvement in the household's food security, for example, if we anticipate and transfer cash earlier. And this is being studied by the World Food Programme and the World Bank in the case of Nepal, where they had an anticipatory action component to their humanitarian assistance. And when a flood trigger there would exceed, the World Food Programme and government partners deliver a one-time cash transfer of $111 as quickly as possible. So they were not able to actually do the transfer 1 or 2 days before the flood happened. They were able to do it as quick as 2 or 3 days after, but this was still significantly quicker than the traditional 2 weeks. Now, the comparison group here receives the cash transfer after the flood. Okay, so like the 2 weeks later, what I just mentioned, and the question here is then, what is the impact of on food security if you anticipate a flood and the transfer of cash is done earlier? Now, like I said, this is in the context of Nepal, specifically these areas here on the map on the right-hand side. And what you need is a reliable flood forecast. So the infrastructure needs to be good for it. You need to pre-register all the eligible participants. So you have to have a very good database of people that are potentially going to be eligible for such a program. There needs to be a willingness to randomize, of course, and you need to do household surveys at different points in time. Now, they did this in 140 villages and settlements, and basically randomized over these 140 into two groups, 70-70, where you have the anticipatory action in group A and the normal post-shock response in group B. This is a quick graph of like how the flood levels or the river levels look like. So as you can see here in September, there was already almost, they reached the warning level, but not really anything happened yet. But then in October, the danger and the warning levels were exceeded and the action was taken. You can see that here in the map, so you can see all these brown little dots are the households, and then the land that was flooded are the red areas. Now, in practice, how did this work then? So you have here the flood peak in the red bar on the October 9th, 2022. Immediately after, they were able to do these cash transfers because they were able to anticipate the floods happening, so they could mobilize everything earlier on. Then they do some surveys to measure both in the treatment and the control group, the traditional group, food security, followed by the transfers to the control group, and then more surveys were done. This is my last slide, and then we'll open up for questions. As you can see here on the left-hand side, you have the y-axis where we have again the food security like we were looking at before, and then over time the different surveys. So here you have the flood peak. Immediately we have survey 1. So the control group in red, the treatment group in blue, the treatment group had received the cash transfers and therefore had a much higher food security at immediately the first survey that was taken, significantly more so than the control group. But then as the control group was also receiving the cash transfers a couple weeks later, basically there's no difference anymore between the control and the treatment group, and food security levels are the same. And over time, that stays relatively stable. So here, what we win is really this surplus, this difference. Earlier on, people are helped and their food security has been improved within the onset of the disaster. Okay, and I'm going to conclude there. I realized I'm already out of time. So thanks so much for your attention.